Hello, everyone. Welcome back to the Road to Pregnancy podcast, where we provide you with pregnancy-related information and local accessible resources here in Rhode Island. I'm one of your co-hosts, Malia.
And I'm your other co-host, Ashley. We're so excited to have you join us today for a very important and timely episode.
Like you may have heard, on September 22nd, the President of the United States and the Department of Health and Human Services announced that Tylenol use in pregnancy causes or significantly increases the risk of having a child with autism.
Now, we have decades of research on the safety and efficacy of Tylenol use in pregnancy, and studies continue to show that Tylenol does not cause autism. The American College of Obstetrics and Gynecology continue to support the use of Tylenol for pain relief or fever in pregnancy.
With all of the misinformation and confusion on social media and in the news, we thought it would be good to sit down with an expert in the field who can clear up any myths and misconceptions. Before we begin, we wanted to give the disclaimer that opinions and ideas discussed in this podcast are our own and are not affiliated with any institutions. This discussion is purely informational and not intended to provide specific medical advice.
Dr. Megan Lobel is a graduate from Duke University School of Medicine and recently completed her residency in obstetrics and gynecology here at Brown. She's currently doing her fellowship at the University of California, San Francisco in maternal-fetal medicine.
Dr. Lobel is extremely passionate about this topic and recently published an article in the San Francisco Chronicle discussing Tylenol use in pregnancy. We are so excited to chat with her today so she can help us unpack this argument that HHS is making and help us understand the science behind acetaminophen use in pregnancy.
Dr. Lobel, welcome to the Road to Pregnancy podcast. Thank you for coming on to talk with our listeners about this important topic.
It's so great to be here. Thanks for having me.
Yeah, thank you for joining us. So to begin this episode, can you briefly tell us what Tylenol is and how it works for those who don't know?
Definitely. On a biologic level, acetaminophen, which I'll refer to for the rest of our time together as its brand name Tylenol for sake of ease, blocks a type of protein called cyclooxygenase in our nervous system. Cyclooxygenase enzymes produce prostaglandins, which are hormone-like chemicals that increase the pain response and raise body temperature. By reducing these prostaglandin levels, Tylenol lowers pain and fevers.
That's a great explanation. So with that in mind, let's just dive right in. Is Tylenol safe to use during pregnancy?
In short, yes. Tylenol is a safe and effective medication to take in pregnancy for many indications, including pain, headaches, migraines, and fever.
And how do we know that? Can you walk us through what the most reliable evidence shows right now about Tylenol use in pregnancy?
To borrow the words of Dr. Stephen Fleischman, the current president of the American College of Obstetricians and Gynecologists, or ACOG, in more than 2 decades of research on the use of acetaminophen in pregnancy, not a single reputable study has successfully concluded that the use in any trimester of pregnancy causes neurodevelopmental disorders in children. He cites multiple studies, one of which was a recent Swedish population study that observed over 200,000 children over 25 years. Importantly, this study included a sibling comparison to account for genetic, social, and environmental factors that may contribute to neurodevelopmental disorders. There's no evidence of causality at this point in time.
So we've seen the administration actually say the opposite, that Tylenol causes autism despite this evidence that we have to the contrary. So why do you think these claims are being made, and what are some of the main flaws in the studies that they're referencing?
The studies that are frequently pointed to as evidence of a causal relationship include many of the same methodological limitations. For example, studies did not correctly control for confounding factors, meaning a third factor that can distort the true relationship between Tylenol and autism, things like genetics, social factors, or the environment. Additionally, the majority of studies use unreliable self-reported data. Essentially, they're asking patients to look back on their pregnancy several years later and recall if, when, and how frequently they used Tylenol. As you imagine, it can be quite challenging to recall exactly what you were doing last month, let alone several years ago. Additionally, parents of children with a known diagnosis of autism may be more prone to seek answers as to why this condition came to be. So they may over or inaccurately report medicine use in their pregnancy. This is called recall bias. It's challenging to speak definitively as to why the administration chose to reference these flawed studies over more reliable and robust data, but there is a clear bias in the evidence that was reported nationally.
That makes sense. And I think that recall bias is really important to keep in mind because it's hard to remember medications that you were taking years ago. And I think, people are searching for those answers. And so there's also been some confusion online about old 2017 Tylenol tweets that resurfaced where the company said that they don't recommend using their products while pregnant. And many people saw that and got worried. And so is there any truth to that tweet? And why do you think they may have shared that statement?
I have to believe the statement was timed in response to the publication and sensationalization of some of the more flawed cited studies. While I don't pretend to be an expert in business strategy, I can imagine it's important for brands to avoid any association with conflict or ties to controversy. In reality, the brand was getting to an important point. Manufacturers should not be making global medical recommendations for patients. Rather, discussion with a qualified healthcare provider is imperative to receive accurate and individualized care.
That's a really important point. Not just trusting the tweet or trusting people who are speaking on this topic just because, but trusting the people who have, dedicated their lives to studying medicine and the safety of these medications in pregnancy. So I agree and echo your point that it's important to get that advice from a medical professional and speak about your specific case too, because not everyone is the same. Another thing that we've seen the current administration try to do is connect like circumcision rates and Tylenol use related to circumcision and autism. What are your thoughts on this?
I believe this is in reference to HHS Secretary RFK Jr. claiming that circumcised boys may have higher rates of autism and suggested it's likely due to the use of Tylenol as a pain reliever for the procedure. He referenced a 2015 Danish study that found higher autism rates in circumcised boys, but this study did not collect data on Tylenol use. Notably, Tylenol isn't routinely used for all circumcision procedures, given that there are more effective options such as nerve blocks and soothing techniques. Medical experts continue to state that scientific evidence for a causal link is lacking and that autism has multiple complex causes that aren't addressed in these studies.
Okay. And just to kind of think generally, why do you think misinformation or sensational headlines like these can be so damaging in pregnancy care?
Yeah, healthcare misinformation is growing increasingly pervasive online. It preys on patients seeking to educate themselves about their bodies, their health, and their options for care. Content creators are tasked with producing attention-grabbing headlines and catchy videos to generate views and clicks for profit. It behooves them to create increasingly divisive and sensational videos that aren't beholden to the truth. Thus, misinformation spreads rapidly.
That's such an important point. And why do you think that posts by like ACOG or SMFM aren't getting the same publicity or engagement that these other posts are?
It's really hard to combat folks that have millions and millions of followers and create content beyond the sometimes pretty dense medical literature that's out there that ACOG and SMFM are tasked with producing. So it can be really hard to outcompete those really exciting and flashy headlines.
We've talked about it a little bit, but again, just to reiterate, what are those organizations saying right now about Tylenol use in pregnancy?
Yeah, so ACOG and SMFM are two of the governing bodies for obstetric providers in the US. They are tasked with setting the standard of care and ensuring that providers across the country are up to date with the latest evidence-based guidelines. They, along with several pediatric and medical societies, repeatedly affirm the safety of Tylenol in pregnancy when used appropriately.
Awesome. And just to talk about the practical safety, what is considered a safe dose of Tylenol during pregnancy? And is there a cumulative effect if someone uses it frequently over time?
Great question. A general principle when taking medicine in pregnancy is to always use the lowest effective dose, or rather, treat with the smallest dose of medicine that works and avoid medications if you don't need them. Pregnant people can take up to 1,000 milligrams of Tylenol every 6 hours with a maximum of 4,000 milligrams per day for the duration needed to treat the problem. Now, I will say many folks can have alleviation of symptoms with a lower dose, but of course, this is individualized based on severity of symptoms and what you're treating. With respect to if there's a cumulative effect over time, many studies have looked at this question and have failed to produce reliable evidence that show that there is a link between prolonged use of Tylenol and autism.
And then, are there any general side effects or risks pregnant patients should keep in mind when using Tylenol?
If it's the first time a person's taking Tylenol, they should watch for signs of an allergic reaction, things like rash, hives, swelling of the face, tongue, or throat, or shortness of breath, though these are rare side effects. Chronic or overuse may result in liver damage, so patients should be judicious in their use and, of course, consult their doctor if they have any questions or concerns.
And I can also imagine that some pregnant women would just want to err on the side of caution and avoid all meds altogether. And so I wanted to ask, what are the risks of not treating pain or fever during pregnancy?
This is a really excellent question and point. The conditions that people are treating with Tylenol during pregnancy are often far more dangerous than the theoretical risks that can lead to severe complications for both mom and baby. For example, fetal exposure to high and persistent fevers can damage fetal neurons that are developing, which can lead to things like neurodevelopmental outcomes. Also, Tylenol can help us determine the severity of some conditions. For example, persistent headaches can be an early sign of preeclampsia, a condition related to high blood pressure in pregnancy. If the headache doesn't go away with medications, we may need to recommend premature delivery in order to avoid progression to eclampsia or maternal seizures. We know that prematurity in itself is associated with neurodevelopmental issues in children. Therefore, we want to avoid prematurity if possible by treating the headache.
Are there any groups or specific medical conditions where you would advise against using Tylenol?
Certainly those with an allergy to Tylenol, and additionally those with chronic diseases, particularly liver and kidney disease, or those on multiple medications should consult their doctor prior to use.
Okay, and many people also wonder about alternatives, and often have heard the recommendation against taking ibuprofen during pregnancy, for example. And so, can pregnant patients take Advil, Motrin, Aleve? What are those? And if not, what are some other safe options for pain relief?
We are quite limited on how we can treat pain in pregnancy. More conservative or initial options can include things like rest, heat or cold therapy, gentle massage, or possibly acupuncture, though there are limited data to show its effectiveness. Unfortunately, we do have clear evidence that ibuprofen, Advil, Motrin, and Aleve, which are all part of a class of medications called NSAIDs, are not recommended in pregnancy. NSAIDs can cause fetal kidney dysfunction and after 30 weeks can increase the risk of a premature closure of a key fetal blood vessel. While there are times where these medications may be necessary, they should be given after consultation with and under strict monitoring by a physician.
And I guess that point just really re-emphasizes how detrimental this narrative is right now about Tylenol use in pregnancy, given that it's really our only option for treating the things that we were talking about earlier. And if someone has heard all of these autism claims and they've scrolled on social media and they've seen all of this information and they feel really anxious about it, how would you reassure them, and what should they keep in mind when weighing the benefits and risks of using Tylenol in pregnancy?
Absolutely. We've already seen this happening on our labor floors. We know that people are doing everything they can to keep their baby and themselves safe during pregnancy. Pregnancy care providers are aligned with that goal and would never recommend something they thought to be harmful. When considering the use of medication in pregnancy, it's important to consider all potential risks along with the benefits, which we as physicians are trained to do. The data from numerous studies show that Tylenol plays an important and safe role in the well-being of pregnant women.
Great. And so, just to kind of like wrap all of that up, if you could give one clear message to expectant parents about Tylenol use in pregnancy, what would it be?
It would be that pregnant people should not suffer. Safe, effective medication is available, and using it may actually prevent harm. We recognize how distressing it can be to hear conflicting information in such a high stakes context, and urge folks to talk directly with their obstetric care providers for advice grounded in science, not fear.
That's a great summary statement. Dr. Lobel, thank you so much for sharing your time and expertise with us today.
Yeah, thank you so much. This conversation really helps clarify what's evidence-based and what is just noise online.
Absolutely. It was my pleasure. Thank you for the opportunity.
And to our listeners, if you'd like to read Dr. Lobel's article in the San Francisco Chronicle, we'll link that in our show notes.
And remember to always talk to your healthcare provider before making decisions about medications during pregnancy.
Thanks for listening to Road to Pregnancy. Don't forget to follow, rate, and share this episode so more people can hear accurate information and feel empowered in their pregnancy journey. See you next time.